Health officials and other experts in Egypt meet to look into preventive measures to deal with the so-called coronavirus that has sparked fears across the country. According to Egyptian Health Minister Adel Adawi, the virus was contracted by an Egyptian citizen who had recently returned from Saudi Arabia.
The case has been quarantined based on information from his family members who say that he had spent time with some relatives in Saudi Arabia who are affected by the coronavirus. He was directed to the fever hospital in Abbasia and samples were extracted as agreed upon. Throat swabs and nose swabs, and also from spit. It was proven yesterday that the case is positive and that the patient is suffering from the coronavirus. Consequently, I have invited the committee to an emergency meeting to put in place all preventive and curative measures that are specific to fighting the possibility of an outbreak.
The health minister now says there is heightened concern about the potential spread of the virus because many Egyptians will be making religious pilgrims to Saudi Arabia during the coming months. The government has also embarked on extra measures to identify those infected and raise awareness amongst other travelers.
Also, we'll be supporting hospitals specializing in the chest fevers and medical teams, as well as paying special attention to the procedures of fighting the contagion when it comes to these hospitals and also in the intensive care units, because these cases may evolve. All these preventive and tracking measures were studied by the committee and guidelines were put in place to cure the patients that may suffer or are suffering from the respiratory infections without panic or fear amongst the community.
Saudi Arabia, which has been hardest hit by the MERS virus, has recorded a total of 313 deaths. Although the number of MERS infections worldwide is fairly small, the more than 40% death rate among confirmed cases and the spread of the virus beyond the Middle East is keeping scientists and public health officials on alert. The virus, which appeared in the Saudi kingdom in 2012, is considered a deadlier, though less transmissible virus. Susan Mongeli, CCTV.